Hi everyone, welcome to Unit 7, The Future of Nursing Informatics. I'm sure that we already discussed in my previous video discussion about the future of nursing informatics, but in this lesson, we will try to dig deep what the future holds for nursing informatics. This week, we will examine the future of nursing informatics as new directions and priorities emerge in healthcare. Nurses must prepare for the future. Nurses will need to keep appraised of the changing environment and the rapid advancements in technology in order to keep pace. We must be ready to embrace the changes that technology brings. Technology has definitely changed the way we practice nursing and deliver care. With change, there are both opportunities and challenges. Our goal for this week is to describe the role of information technology in improving patient outcomes and supporting safe care environments. By the end of this week, you should be able to examine the future of nursing informatics, explore current issues in nursing informatics, discuss nursing informatics yesterday, today, and tomorrow, identify challenges in informatics, examine the future trends in informatics, and appreciate the future of nursing informatics in our rich technology-laden healthcare environment. As we discussed in our previous lectures, nursing informatics, even if it started in the 60s and 70s, is still in its infancy period. According to McGonigal and Maestrian 2021, that informatics will still influence the development of intraoperable electronic health record to accurately capture and share patient data and capture the care that nurses give to their clients. According to the same authors, that programs are still in the development to keep nurses and healthcare workers abreast of the technological changes as they occur and educating new and current nurses which possess a challenge to the information nurse specialist. The past 3 decades have brought unprecedented advancements in the use of technology throughout the world, and the impact of healthcare has been monumental. Nurses have adopted tools into their daily work that have transformed the way they practice. The coming decades will bring technologies that will focus on providing nurses greater access to information where and when they need, according to Ball 2000. As we have learned in the previous units, informatics is a combination of computer science, information science, nursing science, and cognitive science designed to assist the management and processing of data, information, and knowledge to support practice. Many of the current issues we see in informatics are related to data, information, and knowledge. Knowledge check. Please read the question number 1 and write the answer on a piece of paper. I'll give you time to do this and transfer your answer on knowledge checks on a separate stream. Nursing data issues. So the following are the issues in nursing data. So 1, identification of the relevant nursing data. So there are a lot of nursing data available. Nurses input objective and subjective data, and it is very important that nursing informaticians classify this data according to what type of data it is. Conceptual frameworks for structuring nursing knowledge is either we adopt a framework from a specific theorist or develop our own framework. So we have to develop these frameworks to assist us in building the nursing knowledge using informatics. Difficulties of knowledge development about nursing data. Questions about which data elements make up the minimum nursing data set. So this is like, what are the standard question that we have to ask? So these are examples. For example, a patient in a specific clinic will be admitted, and this clinic has a set of questions to be collected from the patient. And on the other hand, the other hospital, other clinic has a different set too. So we have to standardize those nursing data set. Next is classification systems and clarity around equivalence of definition, measurement, and underlying technological assumptions. So different clinics have different definition, terminology. So that is one of the issue of nursing data. For example, In the Philippines, we call it endorsement, and in Canada and United States, we call it a report. So we have to standardize those information. I mean, those terms, and that's an issue in nursing informatics because um, we don't know the equivalence of these words from different work environments. Next is difficulty automating data capture and monitoring. Next is difficulty of measurement due to complexity of nursing phenomenon. So nursing is difficult to what do you call this? The nursing is difficult to standardize. It's because it doesn't follow a specific step-by-step pattern or a procedure. Some of our interventions are procedural, but the rest of the nursing interventions are not procedural. It's based mainly on nursing knowledge and intuitions too. That's how difficult it is to capture nursing information. Next is ambiguity of measuring nursing phenomena, and like how do you measure what's normal? What's normal to you may not be normal to others, and what's the observation of another nurse is a different observation from another nurse. So we have different assessments. So we have to standardize those. Next is maintaining the richness of data, difficulties standardizing data, and difficulties with managing data and establishing proper parameters. So those normals, so we have to adapt. So we already talked about this in our previous slides, that we need to adopt standards from different authors or different protocols. We have to like NANDA, we have to adopt terminologies from NANDA, which are standardized already, so we can make use of them. So the following are the issues in nursing information. So difficulties modeling the data of nursing. So like what really is the model of nursing? So there are a lot of models for nursing, and no one can pinpoint that this is the actual model. So in the institution where I work, we finalized, like we decided what model of nursing we have to use and what structure of nursing knowledge should we use. So in order to standardize and create a uniformity in the entire organization. Next is lack of representation of classification systems that do not capture the entirety of nursing practice, and differing conceptions and nursing taxonomic labels for nursing phenomena, like different in other hospital they call it fever, in other hospital they call it hypothermia, and different situations but the same different terminologies but the same situation. So there's a lot of ambiguity and different conception in nursing. Challenges with differing designs or for different applications. So for some reason, I think nursing is very creative. Like I remember a long time ago when we have the manual recording, the forms. I'm referring to the forms. Another person's form is different from another person's form. So we have so what should be the standard form? And yeah, so there are challenges because different informatician has a different design. So we have to standardize that one. And the last one is difficulties with processing information. So this is very important because of the different conceptions and different perceptions of nurses. We process data differently. And what's sad to say is that with data, so we have to process data in order to create a high quality information, right? So sometimes data that are entered into the system are dirty data. So dirty data if you process dirty data, they will result into garbage, right? And it's detrimental to our patients too. So the following are the issues in nursing knowledge. First is early faulty categorization of nursing knowledge, and second one is challenges with differential structuring and processing of knowledge in decision making by nurses. So each nurse has a different perception and different decision making procedure. So we have to standardize. We have like the one I discussed in the previous unit that we need to do. We need to use a theory or a standard theory in order to decide on things appropriately. Now let's check. Please read question number 2 and write the answer on a piece of paper. I'll give you time to do this activity, and please transfer your knowledge checks to a separate stream under this unit. Nursing Informatics Yesterday, Today, and Tomorrow. According to Science Mayor 2010, as we look to the future, nurses can work with their informatics colleagues to leverage technology and transform the way we deliver care. That only happens when nurses are aware of nursing informatics and has the competency to perform such tasks. The same author quoted Dr. Pamela Cipriano, an IOM nurse scholar in residence from the Institute of Medicine forum on the future of nursing, suggested 4 suggestions regarding technology. The 4 specific suggestions regarding technology by Dr. Cipriano are the following. Include nursing. She said that to include nursing workflow as a focus of healthcare IT funding to ensure that systems and devices will ensure nurses to be more efficient and produce safer care. So without the funding, without without the funding, nothing works. So we need the funds, and nursing workflow should be the focus of healthcare IT funding. Next is what else? Because in the entire hospital, the nursing service one is the biggest department of a hospital, and nurses are the ones that manage the entire hospital, right? So we might as well focus on the integration of information technology in that department. Next is she suggested that um, we should advocate for nurses to be included in technology design and evaluation to enhance rapid adoption. That is why nursing informatics is being taught in college, because we want to advocate. We want nurses to be involved in the design of technology, the design of the hospital information system, because these softwares will be a waste if the one who designs it is not a nurse. They tried it before. IT people design the stuff. They design the entire hospital information system, but what happens? Nurses don't use them because nurses cannot relate to them. So we have to advocate. We have to encourage new nurses to pursue courses like nursing informatics or specialization in nursing informatics. So the one who makes the and designs the informatics structure in the hospital is a nurse, and everybody will use it because everybody um, can relate to it. Ensure another suggestion is that she said that to ensure that nurses are seen as meaningful users of technology. So we are not just like using a technology what does she mean by this is that nurses can um, interpret the data collected, can create can do critical thinking. That's what this sentence means. So it's not really the use of computers. So just like our nursing informatics, this is not actually just the use of computer. The use of computer is one, but nursing informatics is really to convert data into information and information into knowledge, knowledge into wisdom. That's why I always give you like uh, situations for critical analysis, so that you have to think, you have to use your mind to be imaginative and innovative. So when the right time comes, then you can use your creative analysis on things and can design by your like clinical eyes, by using your clinical eyes. So it's we as nursing informaticists, we are not the computer guys. We are no longer the computer guys. We are the people who are data driven and process data to create information. Last one is support nurses in moving high technology care into the hospital setting of the future, the home and community. So we have to support nurses in adopting new technologies and adopting new high-tech care. We call it high-tech care. So we have to encourage nurses to promote new forms of technology, and our policies in the institution that we work should be flexible in order to give way for nurses to be more creative in its application for technology, especially in the community area. Then Dr. Cipriano concludes that regardless of the specific nursing focus or title, these recommendations provide guidance to our role in designing the healthcare of the future. It is very exciting indeed, right? There are exciting times ahead of us. Knowledge check. This is question number 3. Write your answer in a separate sheet of paper and then transfer it to a separate stream for knowledge checks. Nurses play an important role in leveraging health information technology, or IT, to improve patient safety, quality, and efficiency of care delivery. So that is the focus of nursing. That is the focus of our role, to improve patient safety, and equality and efficiency. So when you design softwares in the future, you decide to pursue nursing informatics and you would like to design a system, focus on these three things: safety, patient safety, quality, and efficiency. However, nursing informatics is not without its share of challenges, and these are the challenges in informatics: lack of support for clinical application. So people think that we are just like the people who repairs computers, and these are the computer guys. So they don't have interest in it. So they don't know. People who doesn't have knowledge on a specific thing doesn't have interest. So most probably the administration lacks support to clinical application, and that is a challenge in informatics. So as a nursing informatician, you have to heavily justify the application of information system in your hospital, because if you don't justify, nothing will happen, nothing will be applied, nothing will be supported. So you have to use tools in order to make people understand, especially the administration, to understand why you buy this kind of software. When I was working in university in Cebu, in the Philippines, um, I wanted to upgrade our nursing laboratories, and what happened was that I wanted to buy a hospital information software, and then I was asked by the financing department, is there anything? Is there like a physical thing, or like a stuff? So like that they can see the product, and softwares. These are the non-tangible part of a computer, right? So they're asking me for the tangible part, but I cannot produce it because this a software is non-tangible, and the government requires that it should be tangible. So the policy should be changed, and because these policies are old, they do not fit the most current information technology, so they have to be amended. Next one is, and when you amend a policy, and that's very difficult and needs a lot of work. Next is insufficient IT staffing. Sometimes an organization hires IT people, and IT is a very expensive um, human resource. And sometimes in the hospital, they hire people, they are called like IT guys, but they're not really, they don't know how to design or create a website or create a system or develop a software. So I know of an institution before that the one that they hired does not even know how to make a website, and it's too funny. And that's why, like, we need to hire IT people, IT specialists that would help the nursing department or nursing um, field to develop more, right? Next is the need for clinical informaticists. So we don't have this. So we need to, like, encourage our nursing staff to study clinical information systems. So it's another higher what they call this level of information technology. Next is staffing for process workflow design. So I have I have an experience of um, doing workflow in Cebu Normal University. We designed the workflow of the enrollment system, and it takes time to design it. Staffing support, right? So we don't have people to support our staff when we implement information technology, new information technology. We need people to kind of manage and supervise the implementation. Resources and money. Information technology is very expensive. It is very expensive, non-tangible, but very expensive. Technology is very expensive. But once technology is applied, it could, in the long run, could save you money. Lack of time for proper training and implementation of information systems. Lack of time, lack of resources, and lack of manpower, right? And the brain power too. Lack of congruency and fit of informatics into the current existing workflow. So you used to the manual one, and then we cannot. So a long time ago, like I think 10 years ago, in the Philippines, they started to do electronic work. So I've seen that nurses do the chart, they record, the document stuff in the chart, and also document in a computer. So it added a new job for nurses, and that's very difficult. So the purpose of electronic digitalization or doing electronic health recordings or documentation is to streamline the documentation process and cut off any bureaucracy within and make life simple. And that one, and I saw, was very complicated. They entered their progress notes in the computer and then write it in the chart after. So actually that's not actually the purpose of nursing informatics. Lack of full organizational buy-in and support for the system, and shortage of trained, experienced informatics nurses. So we need the ones that studied nursing informatics and the ones that are trained for nursing informatics. Once again, these are not the computer guys. These are not the ones that we call and then fix the computer. These are the analysts, the one that uses critical analysis in this, in deriving information out from knowledge out from that raw data. Limited number of schools that include informatic competencies in the curriculum. In the United States and Canada, there are a few. In the Philippines, I really don't know if there are um, universities that offer nursing informatics. When I was the dean of Cebu Normal University, I strive to um, not improve, I strive to develop the College of Nursing to be trained. I tried to send um, instructors to Singapore to be trained for nursing informatics. But um, I think 10 years ago, time is just too early for me. I went to Canada and it hampered the development. Yeah. So in Canada, we have couple of those universities that offers nursing informatics and some health informatics. And in the winter intake, I guess I'll start my master's in health informatics in Waterloo University here in Canada. Knowledge checks. Please read the question. This is question number 4 and write the answer on a piece of paper. I'll give you time to do this, and if you need more, please pause this video. Every day there are some new innovations in technology, and as a result, we will see a number of trends that will emerge in the future. So these are the list of trends that will emerge in the future. Number one, rapid changes in healthcare technology and therapies, demographic trends, epidemiological trends and healthcare statistics, and flow of resources and money, supply of human resource and competition, increased role expectations and responsibilities, consumer-driven care, patient as partners. So I think this one is already started at this point that patients are our partners. Um, we're not we're actually not in the age where doctors tell the patient what to do and they follow. Right now, patients are more knowledgeable because of internet access, so they can give input, and also they take care of their health. Their health is their responsibility. Global trends. So it is not only this clinic that works like this. It is a global revolution. It during the time of pandemic, we realized that the world is very small. Evidence-based practice, integrated. This evidence-based practice already started. Integrated, interoperable electronic health records. Interoperable. Remember that word interoperable? It means to say that it can be used anywhere. It can be it is operational everywhere. E-learning, mobile learning. You'll see that more of this in the future. And during the pandemic, it kickstarted the e-learning and mobile learning feature of the academics. And lastly, increase in online learning and distance education. So right now, everybody's online, and education is online. And I have seen a lot of literatures that says that online is what they call, is not effective. But I tell you, I studied nursing here in Canada, and mostly it is online. And then when we go to we do the simulations online too. We do our demonstrations online, and we go to um, the clinical area. We work good. We work best. So I really don't think that online or distance learning is not fruitful or not productive. It is productive. It's just that people needs to have discipline in online learning. You have to motivate yourself to learn. It is an independent learning, so no one forces you to learn, but you have to help yourself to learn, right? If you don't learn with a discussion, then go to the internet and search about a topic, right? It's an independent learning. It's a type of an adult learning. So to learn more about the future trends in informatics, go to Google and type in guidepost up to the future, or on the link below. I put a link below in this stream, and you can open the agenda for nursing informatics. Knowledge check. This is question number 5. Write this in a separate piece of paper and then transfer it to a separate stream that I will be posting. If you need time, please pause the video. So these are the 5 trends that will influence the future of nursing informatics. Changing practice to role in nursing. So nurses will be more on the leadership than to like the bedside nursing. Increasing informatics competence requirements for all nurses. So nurses will be trained on a higher level. I think nursing informatics, this one course, is only a kickstart. Soon, another course in relation to informatics will be added to the curriculum. And rapidly evolving technology. So this will influence the future of nursing technology informatics. If the technology will be high tech, the care will be high tech, and the knowledge of the nurse should be elevated. Regulatory changes and quality standards that include healthcare consumers as part in healthcare models. So our patients now are consumers, and they are valuable in business. So our healthcare models should include them, and they should be the center, the patient-centered care. They should our models of care should be patient-centered. Okay. And lastly, care delivery models and innovation. So these are according to McGonigal and Mastrian. So as we arrive to the future, and I'm sure you've witnessed that when COVID-19 started, all academic institutions flipped to online classes and healthcare institutions flipped to telemedicine. Now more than ever, we realize that we need the healthcare team prepared for informatics competencies. According to my favorite source, McGonigal and Mastrian 2021, that all healthcare providers, that include us, nurses, should have education on informatics because they need basic information skills. Example, using search engines to find a specific topic. So this is basic. On the other hand, some healthcare providers need to attend classes or seminars to improve their skills and knowledge, and those joining the nursing field need a general knowledge of computer capabilities. In short, we need to advance our knowledge and skills in order for nurses not only to appreciate a specific technology, but to use it and interpret the data collected from a specific technology to make it into information and consequently wisdom. So that's when that's when nurses are meaningful users of technology. Question number 6, write your answer on a separate piece of paper. If you need more time, please pause the video and transfer your knowledge check to a separate stream later. So nursing informatics is not only for nursing, so it supports the interprofessional team. So interprofessional team is composed of doctors, nurses, PT, OT, social works, and others. It's a big group. So Holden et al. 2018 is quoted by McGonigal and Mastrian 2021 laid out 7 best practices on how nursing informaticians can support the interprofessional team. Number 1, adopt the characteristic of effective teams. So um, I think I discussed this before that nurses should not build silos of knowledge, but an open field that caters other what they call this other professions. Number 2, practice leadership and followership. So when I was in the Philippines, leadership was being promoted, and they forgot to discuss followership. So when leadership is that when you lead people, right? So followership is an art of following a leader. So without followership, leadership will break into pieces. No one will follow. I think as a Filipino, we don't have a good followership. I realized that, yeah, we might follow silently, but the art of following, actually, blind following is different from followership. We're good with blind following, not with followership. So when you will have your course in leadership in nursing, ask your teacher about followership, what followership is all about. Next is clearly communicate with the aid of tools. So when you discuss and try to like explain to your nurses, to other people, to the administration, try to make use of PowerPoint presentation, tools or videos so they better understand. Next is design team meetings for effectiveness and efficiency. You can use telephone conference or a video conference that makes it more easy, so people will stay in their offices and not to go in a specific area where they have to walk or drive. Articulate your skills with respect to health informatics and develop your skills and knowledge in interprofessional teamwork and domains. So we already discussed this, like the behavior. Remember the simulation that we have before? So this is like the behavior, your behavior in order to work in interprofessional team. And lastly, ensure health informatics education supports interprofessional collaboration. So it doesn't make a silo of like, hey, we're nurses, we are different from you. So you have to be open to everyone. So, do you like change? According to McGonigal and Maestri in 2021, that change plays a very significant part or plays a significant role in healthcare today. And those interested in nursing informatics must embrace change, and they must be good in convincing others to embrace change as well if they want to truly transform healthcare practices and ensure excellent outcomes. You will become an informatics nurse specialist when you become when you will become a informatics specialist. Make sure that you use your technology when you educate nurses. I have this experience before when our educator encouraged us to use the computer to give when we give report. So report here is equivalent to giving endorsement in the Philippines. Like after end of shift, you give endorsement. In Canada, you say you give report. So she said, use your computer when you give report, and then she never had an experience in giving report using the computer. One time she was like about to demonstrate how to give a report using the computer, and she lost it. Okay, now, so you have to practice on what you teach and be excellent about it. Another experience of mine in relation to change is when COVID-19 hits and we have several patients visiting the hospital and for signs and symptoms of COVID-19. So the hospital created an area where patients can visit physically, but doctors are in their office or home in order to prevent COVID infection, right? The first time I was assigned in the unit, the manager asked me if I know how to do telemedicine and Epic, and I said I was trained for Epic, but not telemedicine. So they grabbed me and put me on the table in the office, and they gave me a computer and to watch a 30-minute video um, video on how to assist in telemedicine and how to, you know, do it. So the instructional video was straightforward, and my goal is to understand the concept and know what to do so I can do my job. In 30 minutes, I was up and running the telemedicine area. So as a nurse, we have to be highly adaptive, and we have to use our brain and use the competency in nursing informatics that we learn from school. I know in the Philippines, I know that the Philippines is striving hard to modernize the healthcare system, especially in the nursing field, and we have to benchmark on other countries which has a strong informatics background. About 8 years ago, when I was in the Philippines teaching nursing informatics, we have to travel to Singapore, Hong Kong, Malaysia, Macau to benchmark best practices in these regions, and we are surprised that in the Philippines we are lagging far behind on our neighboring countries, and this is the reason why why your dean, Dr. Marcelo Lopez, asked me to ask me for a favor to teach nursing informatics in an attempt to give the Philippine student a good education from a nurse who works on the countries where informatics is strong. So Canada is a member of those 8 countries that has a very strong nursing informatics background. In the future, our basic education will change to incorporate informatics competencies. I'm thinking that computer coding will be it will be placed in nursing curriculum, so nurses will design um, softwares, clinical softwares. In general, clinical care environments be connected, and information will be integrated across disciplines to the benefit of care providers and citizens alike. Knowledge check. This is question number 6. Write your answer in a separate piece of paper and then transfer this later. If you need more time, just press pause. Do you remember your assignment on website critique? So that is an advanced project on informatics tools on the web. So nurses today rely on an assortment of informatics tools in their practice to collect, analyze, and manage information related to their patients. This enables them to provide a safe and effective delivery of care. There are a number of tools that nurses can utilize, and some of the examples based On this, some examples of these tools include but are not limited to the following. Number one, specialized clinical content. So presents pathophysiology, diagnosis, treatment, nursing diagnosis, nursing considerations, and patient teaching information in various disease and conditions. Number two is drug database. So drug database presents comprehensive information about drugs, including over-the-counter medication, herbal medications, and dietary supplements. So in our hospital, we have a drug database. It's actually a very good database. They give us an access to it, and then we install it in our cell phone or in our rover. And then if we are to give a medication and we don't know the medication, we just go to the drug database, and the drug database will give you information on what to do, if the drug, how to give, what are the dosage, if a nurse can give or a doctor will give it, and what is compatible, because sometimes you give it via the IV, right? And then when you give it via the IV, you need to know if it is compatible with the current IV fluid that is running or not, and you have to be very careful about that. Next is symptom checker. Presents a list of potential diagnoses based on patient-specific information the nurses enters. So in Epic, if you enter some vital signs and all the assessments that you do, and you enter in the computer will detect the symptoms and analyze them into an information. It will say, oh, this patient has sepsis or something like that. Number four, drug interactions checker. We also have this in our hospital information system. It describes potential interaction considerations as they relate to drug, drug herbal, and drug to nutrient use or drug to fluid use. When you give medication, you scan the medication, you scan the patient, and then the rover will tell you that the patient is allergic to this antibiotic, or do not give hazardous because you are giving this other medication. So it compares and it gives you the interactions. So so you're given the chance to provide your patient the safe nursing care or safe administration of medications. Five is IV compatibility. So this is very important. Very important. What they call this feature or tool. So it describes the compatibility of drugs and solutions. So there are antibiotics that are not compatible with lactated ringers or not compatible with NS, and this is a very good. I don't know if I still have that in my cell phone. So the name of the software that we install, we ask the what they call this. We ask the our workplace to install Lexicom. So this is Lexicom. So this is Lexicom right here. I don't know if you can see it. Yeah, it has an interaction checker, and it has a 3 cells IV compatibility. So we install it in our cell phone, and if we give medication and we forgot, and we want to check about it, so we just go to the IV compatibility. Next one is laboratory manual. It's presents a point of care reference for lab tests. In Epic, in the hospital information system that my hospital that our place of work uses, has the references, so it's easy. You don't have to memorize it. Number seven is illustrations. Presents illustrations related to anatomy, diseases, and disorders, procedures, and more. So if the doctor in Epic, if the doctor orders um, enema, for example, enema, so it has a link in there on how to initiate enema. Number eight, dosing and medical calculators contain drug-specific dosing calculators and medical calculators such as body surface area to daycare activities. The computer is programmed already. So if you enter in Epic the weight of the patient, the computer computes the BSA of the patient and everything else. Number nine is patient charting. The patient vital signs, admissions, and nursing assessments, care plan, and nursing notes can be entered into the system either as structured or a free text. So structured, when the computer asks you questions like alert oriented, yes or no, and also your progress notes when you write you receive a patient speaks full sentences, alert oriented, something like that. Number 10 is staff schedules. Nurse can self-schedule their shifts using scheduling rules provided in shifts modules. We call it smart assignment in Epic, where we can see our patient load and our schedules as well. Number 11 is clinical data integration. Here, clinical information from all disciplines can be retrieved, viewed, and analyzed by nursing staff and then integrated into a patient's care plan. So this is a very good feature where you can read the documents found in the patient's um, clinic. Another example is the medication that patient is taking. So in Canada, we can access the information that you take at home. Uh, Pharmacy can do that. Number 12, and the last one is decision support. Decision support module can be added to nursing informatics, and they provide prompts and reminders along with guides to disease linkages between signs and symptoms, etiologies, related factors, and patient population. We already talked about this when the system prompts you for sepsis or prompts you for any other conditions. So this is a decision support. So artificial intelligence of Epic supports the physician to decide properly. These are just a few of the tools that nurses can utilize in their day-to-day care activities. So what the future holds? The future of nursing informatics looks bright. With rapid advancements of technology, we can expect to see a number of innovations, such as the quantity of electronic resources will multiply significantly, with mobile devices becoming increasingly powerful. Can you imagine your mobile device is a powerful tool now? It's even an iPad is even powerful with a versus computer, right? The variety of devices will increase to meet the diverse needs of the four domains of practice in all roles and settings that nurses work in. Next is that clinical decision support software will become increasingly sophisticated, recognizing when automatically documented patient assignments fall outside of normal ranges, prompting automatic communication to the nurse or physician via email, texting, or paging. Example, an abnormal blood result from the laboratory initiates a text message to the nurse identifying the patient, the abnormal result, and the impact of any current interventions or aspects of care. In the place I work, it just turns the entire thing red, and you will note like what it's abnormal. Then you have to call the doctor. Smart cards that authenticate the nurse's identity through a close proximity or reader. We already use this one in the place I work, so we open doors with the use of our badge and our fingerprints as well to get medications. It will be popular for nurses and other healthcare providers, allowing quick access to computers and all required computer applications. So in ER, we just tap our badge to open the computer and it logs into your accounts. It memorizes your password just by tap. So next is increasingly lifelike simulation and the use of virtual reality for educating students and staff. So I know we tried one virtual simulation. Now unit 7 of unit 7 activity, one of the activities is virtual gaming simulation. So you need to participate in the emergency room virtual gaming simulation that I will post in a separate stream. And at this time, you are the ER nurse, but I'm not expecting you to do a perfect score in your interventions, okay? But you need to answer the following based on your experience in the virtual gaming simulation. So in this simulation, there were monitors at the patient's bedside. So my question is that, do you know what the alarms are for? Do you understand what the numbers in the monitors were? So you need to answer that. Another question is that there is also an IV pump at the bedside. Do you know how to operate it? And there is also an electric bed. Do you know how to operate, how to like operate the electric bed? And the next question is that what technological idea would you recommend to the ER manager to implement after playing the virtual gaming simulation? Next question is that did you see the piece of technology in Abel's or Charlotte's finger stick in here? In the simulation, you will know Abel and Charlotte, and you will see a piece of technology that is attached to their finger. Do you know what is that for? And the last one is that what are your reflections on the effectiveness of VGS as a tool for student learning aside from your skills? Do you think you are comfortable operating those equipment in the simulation? So please write your reflection on a two page paper, excluding cover and reference page. Use CPA 7 format for your references and your citations, and also for your cover page. And also use only Times New Roman or Calibri 12 font and two space. Okay. So let's continue on what the future holds. So there will be developments in telecommunications, and telehealth will allow for more sophisticated distance patients visit and will save practitioners time and improve care for household patients. Next is bioinformatics. This is a new one. Bioinformatics will continue to unravel information related to gene function and will help to uncover individual gene therapies that nurses will readily apply to their patients. So in Canada, the College of Nurses of Ontario is trying to increase the what they call this role of RNs. I think they're studying on allowing RNs to prescribe medications. And soon enough, this one, the bioinformatics, nurses will be allowed to apply this into their patients. That will be soon. Okay. Speech recognition will improve dramatically, providing opportunities for healthcare providers to dictate to a system which will accurately document in the patient's record, saving significant amount of time. It already started. In the place I work, we use speech recognition in writing. Doctors use that. Well, nurses we type, but doctors use speech recognition to write their history of the patient, all the stuff. Yeah, we already use this one. And then consumers of healthcare will demand more online healthcare services as they expect from their banks and other service industries. Patient will have personal health records, have the ability to schedule their own appointments and retrieve test results with some associated analysis, communicate with their healthcare provider or practitioner without leaving the home, and participate in social network forums and provide a supportive element through sharing and have it in their fingertips, their personalized health information that assists with self-management. Knowledge check. Please read question 7 and write the answer on a piece of paper, and I'll give you time to do this. If you need more, please pause. Hit the pause button. So in one of the hospitals here in Mississauga, they use this robot to interact with visitors. So a greeter is no longer needed. So how artificial intelligence is influencing the future of nursing? According to Merriam-Webster, artificial intelligence is defined as a machine's capacity to imitate intelligent human behavior such as reasoning and problem solving. In healthcare, AI is frequently AI frequently refers to computer software programs designed to interpret data, for example, patient records, administrative claims, medical imaging, and data from mobile devices. Learn from that data and from inform clinical and operational decision making. Investment in AI is increasing as healthcare organizations seek to improve care and lower the cost. Healthcare AI isn't a stuff of science fiction. It uses computational algorithms and electronic health record (EHR) as the data source. And I've learned that universities here in Toronto are experimenting on artificial intelligence. They program a human body functioning as a human as an artificial intelligence inside a chip. Artificial intelligence should be developed to support tasks and reduce clinician burden. So this is to free the clinicians. You know, clinicians when they work, they follow algorithms. So that's easy to what they call this easy to create into artificial intelligence. Unlike unlike nursing, or sometimes our care is based on intuition. So the 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 system cannot program that, but doctors use algorithms, so they can be freed from other doctors' job, and doctors will have more time to um, think and study about what the patient is what's going on with the patients. Nurses and AI. Nurses deliver the best possible care by engaging in core practices such as assessment, planning, and outcome evaluation. Few nurses, however, possess an understanding of AI applications, including machine learning, deep learning, and natural language processing, or NLP, and their applications for nursing research and practice, as well as their potential role in providing patient care and health outcomes. So, AI definitions, one of which is machine learning. So AI in healthcare is due to the potential of machine learning. So the learning here refers to software self-adjustment. It's not like humans that we learn from our experience, but in here it's the software adjustment, and the software fine-tunes itself. Um, it fine-tunes an algorithm over time to increase accuracy. So that's what artificial intelligence is. It's not like humans. So similar to any data-dependent tool, a machine learning tool's function. So the learning in there is the software self-adjustment. Um, and use are only as good as its data sources. If the data sources are bad and garbage, artificial intelligence is also bad and garbage. So this is where nurses are needed. Nurses input improves the applicability and accuracy of machine learning tools. So you see where where's the nurse's role in here to input high quality data. For example, Wang and colleagues developed a tool to predict fall severity to assist in preventing injury in high-risk patients. This algorithm used data such as age, sex, race, bone density, procedural data, and diagnosis to develop a risk for the likelihood of having a fall with a severe injury. In Epic, Epic also gives you the advisory that this patient is risk for fall. So it will give you like a logo, a falling logo, and it's based on artificial intelligence as well. So another AI is the deep learning, a subfield of machine learning and advances nursing, using neural networks for advanced pattern recognition, which has helped machine learning extend to new sources of data, including speech recognition and image analysis. So when your patient has a wound, Epic has a feature to take a picture of the wound, and then you take a picture from day zero and take a picture until the most recent one, and then the system analyzes it, whether it was a healed or did it made any progress or no progress at all. AI can be used to tailor treatments precisely to patients' specific genes, lifestyle, and treatment preferences. The Duke University researchers Tilling and colleagues created Sepsis Watch which is trained via deep learning to analyze over 32 million data points to create a patient risk for developing sepsis. So we have that in our systems too in Epic that it prompts you for septic. NLP is the analysis of EHR text data rather than numbness or other countable elements. A wide variety of applications have been developed using nursing notes, including predicting emergency department patient disposition, uncovering potential financial barriers, and predicting falls. Shaping the future of care. AI has the potential to help nurses improve the quality and efficiency of care, benefiting patients and clinicians. Feeling some angst during the expansion of AI is natural and reasonable, but as AI continues to mature, nurses will need to participate on ongoing open dialogue about its development and the use in healthcare. Nurses will be the key to helping organizations implement and adapt to AI technology transformations as they participate in the development and evaluation of new applications that will shape the future of patient care. So we are the key. So we have to participate, we have to be involved in the development of artificial intelligence. I'll tell you the reason why if we don't get involved. I'll tell you the consequence. Now let's check. Please read question number 8 and write the answer on a piece of paper, and I'll give you time to do this. If you need more time, please press the pause key. The future of nursing 2030. So, the future of nursing, leading change, advancing health, was centered on building the volume of nursing workforce. Its messages were to educate more nurses, especially BSN and PhD prepared nurses, and promote full practice authority for advanced practice nurses. There are also themes
I
connected.
don't know that one.
That's another artificial intelligence right there. I'm sorry about that. So there were also themes connected to growing nurse leaders and improving data collection of the nursing workforce. However, the first report had one very small mention to the use of electronic medical records and no mention of the need for informatics. Fortunately, this report calls for the use of data, information, and knowledge to get used to an equitable, healthy future for all. So the future of nursing 2030 is a report, and I'm just reading some of its highlights. And the full report, not the full report, an abstract of the report is posted in the links below. So the report infuses the importance of leveraging SDOH or the what does this SDOH means? Hold on, let me SDOH is social determinants of health. Social determinants of health. So it infuses the importance of leveraging SDOH or social determinants of health, data employing nurses with informatics expertise, encouraging innovation and providing resource to facilitate telehealth delivered by nurses. Social determinants of data. This includes the technical integration of these data into nursing workflows into a meaningful way with the proper visualization and contextualization so that nurses can efficiently make use of data in clinical decision making. The inclusion of environmental data sharing can aid in responding to public health issues as well as natural disasters or climate change more generally. Also, it discussed about informatics expertise. So the report also notes that nursing informaticists will be needed to leverage artificial intelligence and advanced visualization methods to summarize and contextualize SDOH. What's SDOH again? SDOH means social determinants of health. So what are the social determinants of health? Like education, culture, religion, yeah, those there are a lot of social determinants of health. Searching online, what are the social determinants of health? So um, even nurses who do not specialize in informatics will need to understand how the analysis of massive data sets can impact health investments on expanding program offerings, certifications, and overall student enrollment will be needed to meet the demand for nurses with such skills. So if you are a second year student right now and you plan to be um, a relevant nurse in the future, join the nursing informatics after you graduate BSN, continue studying nursing informatics after. You'll be you'll be a very good nurse in the future. Essential skills for nurses using these new tools will include the ability to project caring relationship through technology. Do you have that ability to project caring relationship through technology and to use technology to personalize care based on patient preferences, technology access, and individual needs? Technology use and innovation. So this is one of the focus area of the report. Um, the use of technology to effectively manage patient populations and to increase patient access. So the use of information and communication technologies and informatics processes should be used to deliver safe nursing care to diverse population in a variety of settings. This include deploying advanced technologies for the analysis of large numbers of data from such sources as sensors, your wearables, and other digital devices that can help with detecting and tracking diseases trends, identifying disparities, and finding patterns of correlations. Tools for data analytics will become increasingly important for improving patient care and the health of population. The report also emphasizes that nurses can not only use but also constructively inform the design and deployment of these technologies so they are free of bias and can augment nursing processes rather than create additional burdens. So this is why you need to participate in um, development of artificial intelligence and participate in the design of um, health information systems. It's because it is to avoid biases, and also when nurses design their own system, it makes the work easier, and it does not make the it does not add more burden to the nurses because nurses hates technology that doesn't work for them and they do not use it. Okay, so in order for nurses to use to become meaningful users of technology, in order for them to participate, the design should be based on how the framework on how the nurses do their job. So the role of telehealth and the importance of training nurses in this technology have been recognized for several years, but the urgent need for telehealth services during the COVID-19 pandemic has made it imperative to include telehealth training in nursing curricula soon enough. Telehealth, there will be a course for telehealth in nursing curriculum, and it is very important to teach that. Moreover, it is anticipated that the shift to telehealth for some of care will become a permanent feature of the healthcare system in the future. Please read question 9 and write the answer on a piece of paper. I'll give you time to do this activity. Preparing for the future. So the report concludes with 11 recommendations to charting a 10-year path forward. That is the future of nursing we're talking about. The sixth recommendation, along with 5 sub-recommendations, is crafted specifically for informatics and technology aspects. And these are the following. You can find it in Table 1. The Future of Nursing 2020 to 2030 report recommendations. So, using technology to integrate data on determinants of health into nursing practice. All public and private healthcare systems should incorporate nursing expertise in designing, generating, analyzing, and applying data to support initiatives focused on SDOH or the what is SDOH? The social determinants of health and health equity using diverse digital platforms, artificial intelligence, and other innovative technologies. Integrate data in SDOH and build a nationwide infrastructure. Ensure the health equity data collaboratives improve visualization of data in SDOH, employs nurses with expertise in informatics to improve individual and population health, give nurses in clinical settings responsibility and associated resources to innovate and use technology, and lastly, to provide resource to facilitate telehealth by nurses. So as you can see, these are the recommendation, and this will be our pathway. And you're graduating in 2 years, and you will be included in this. So you have to prepare yourself for a more modern approach to nursing. So you have to make yourself prepared for the future. Okay. So on a separate screen, we'll have another activity. It's the Unit 7 activity. This is a case study. So imagine, so the question is highlighted right there. So imagine that this case study will happen in 2030. What preparation do you think will help you prepare your nursing practice in 2030? Okay, so this is the story. In the year 2030, enabled by technology, nursing practice has created a professional culture of reflection, critical inquiry, and interprofessional collaboration. Nurses use technology at the point of care in all clinical settings, example primary, acute, community, and long-term care, to inform their clinical decisions and effect the best possible outcomes for their clients. Information is gathered and retrieved via human technology biometric interfaces, including voice, visual, sensory, gustatory, and auditory interface, which continuously monitor physiologic parameters for potential harmful imbalances. Longitudinal records are maintained for all citizens, from their initial prenatal assessments to death. All lifelong records are aggregated into the knowledge bases of expert systems. This system provides the basis of the artificial intelligence being embedded in the emerging technologies. Smart technologies and invisible computing are ubiquitous in all sectors where care is delivered. Clients and families are empowered to review and contribute actively to their record of health and wellness. Invasive diagnostic techniques are obsolete. Nanotechnology and nanotechnology therapeutics are the norm, and robotic supplements are supplement or replacement or replace much of the traditional work of all health professions. Nurses provide expertise to citizens to help them effectively manage their health and um, wellness life plans and navigate access to appropriate information and services. I hope you could read that once again and try to imagine and then answer this question. What preparation do you know now that you think will help you prepare for nursing practice in 2030? And this is the situation, quote unquote, possible situation in 2030. Um, please write your reflection in a separate stream, and it must be original submission, not generated by an online essay generator, with a minimum of 2 pages for discussion, excluding cover and reference pages. Remember to follow APA 7th edition. AI automation and the future of nursing. Next level computer systems have already transformed industries from manufacturing to financial to retail. The pilot projects across the globe suggest nursing won't be exempt from robotic revolution. A robot with artificial intelligence was introduced in a Toronto retirement home to interact with residents and monitor signs of dementia. So researchers at the Massachusetts Institute of Technology are testing robotics decision supports that schedule nursing tasks and assign rooms to patients. And I remember the one that was sent to outer space in the International Space Station (ISS). I think a Japanese astronaut was sent there together with a robot to talk to him and maintain his mental health. Japanese companies are developing care robots that can help patients stand up and even lift and swing them from the bed to the bathroom. Swing patients to the bed to the bathroom. If nurses don't start understanding this, remember this, if nurses don't start understanding this technology and participating in its development and implementation, the profession and the best interest of patients will suffer. So you have to participate. So you have to prepare for 2030, and we have to plan our own obsolescence to some extent, because some predictable nursing work and activities that aren't extremely complex will be automated. By overseeing the introduction of AI and automated technology, we can be sure that more holistic aspects of care continue under the new systems. So these rules might include elements of information management and manual physical tasks such as portering and delivery of supplies. More nurse involvement in technological development will benefit nurses as well. According to Booth, those who embrace technology will be more likely to seek career advancement. So, as a nurse, as a soon-to-be nurse, you have to think about pivoting to a technology-based nursing. So, Richard Booth predicts that many nurses will eventually become higher-level delegators. So, our role will be leaders, overseeing patient care and coordinating other workers and technologies to ensure care is provided appropriately, and will become the new nursing rules. So that will be your new nursing rules in the future in 2030. So everybody, I recommend that everybody should pursue a technologically based nursing. Please read question number 10 and write the answer on a piece of paper. I'll give you time to do this activity. If you need more time, just pause the video, okay? This is the last question. Read question number 11 and write the answer on a piece of paper. I'll give you time to do this activity and transfer your knowledge checks on a separate stream later on. And now I'll introduce you to TAVI. So TAVI uses a pre-recorded video of a nurse to coach patients to manage their health condition and make behavior changes. Patients are prompted to log into the system on a laptop as they answer multiple choice questions. TAVI uses an algorithm to decide which of thousands of videos to play back. So this is a virtual nurse. So this is used for patients with HIV, where information is very sensitive, and sometimes we don't like, sometimes when you're sick, you don't want to ask questions. Sometimes like people will say, oh, I have a friend who wanted to ask this. So this virtual nurse is a very nice and very innovative, shall we say, software or a very good virtual assistant that could help people with conditions. So the one who invented this, I don't know how to pronounce, is Jose Cote, professor in the Faculty of Nursing in the Université de Montréal and holder of research chair in innovative nursing practices. She has overseen the creation, rollout, and evaluation of virtual nursing platform known as TAVI, or in other words, it's the Treatment Assistance Virtual Infirmier. I don't know how to pronounce it. It's just searched online. This one is created from Montreal. So Montreal is in Quebec, Canada, and they speak French, and I don't speak French. So I'll show you the video of TAVI, okay?
Missing doses and deviating from your doctor's prescription as a cause of medical complication. Missing doses and deviating from your doctor's prescription as a cause of medical complications, hospital readmissions, and lower quality of life. Worldwide, non-adherence to long-term therapy for chronic illnesses in developed countries averages 50%. In the US only, it translates into $290 billion in unnecessary healthcare costs and about 125,000 deaths every year. In France, related healthcare spending reaches 2 billion euros per year, 1 million hospitalization days.
So patients are more likely to, according to research, patients are more likely to complete the TAVI virtual sessions when nurses motivate patients to use the technology at routine appointments and when virtual encouragement builds on real life advice. So TAVI complements rather than replaces the nurse's care. So don't be scared because this one just supplements, right? So if a patient repeatedly asks questions, TAVI will not be mad at them, but the real nurse will be so mad. So this one augments the nursing function. Let's continue.
And 8,000 deaths. The TAVI virtual nurse accompanies you through your treatment journey, raising knowledge, skills, and self-efficacy to improve your experience of care and to maximize your health outcomes. With TAVI, you learn the necessary skills to integrate your treatment in your daily life and how to take full advantage of your care team. Interact with the virtual nurse and let her help you learn what you need.
So this is also governed by artificial intelligence. So when a patient logs in and asks something, the algorithm finds which of the previously recorded message that will be presented or played to the patient. So this TAVI can enable the nurse to bond more with the patient because now it's not just the relationship in the hospital. It can be bigger than the hospital. So a future of network home and hospitals systems will mean nurses can obtain feedback from patients more frequently and can offer more timely and targeted advice. So this is a supplementation of the nurse. This will be our alter ego or the alt nurse. TAVI. It is also available in Android and Apple platforms.
It is a personalized experience for you. The virtual nurse supports you beyond the screen with tailored tools and resources, and soon with the first iOS and Android TAVI app. Get the treatment support and care experience you wanted. Discover.
So a future of network and home hospital systems will mean nurses can obtain feedback from patients. I already said this more frequently and can offer more timely and targeted advice. Nurses will become involved in integrating technology into conventional care protocols or introducing new technology. Will need to keep in mind social cognitive theory as it is applied to technology adoption. Nurses should be technology partners, full partners with physicians and other healthcare professionals in redesigning healthcare in the United States, Canada, and anywhere around the world in the Philippines. Effective workforce planning and policy making require better data collection and improved information infrastructure. Of course, as an informatics professor, I immediately observed that informatics knowledge, skills, and attitudes are integral to these key messages. So the stage has been set for assuring that healthcare institutions not only adopt EHRs, but they must also demonstrate that providers are meaningful users of technology. The Future of Nursing report clearly states that health information technology will fundamentally change the ways in which RN plan, deliver, document, and review clinical care. It aptly states that care and its documentation will less frequently be freehand, indicating a need for nursing education to address the value and use of nursing terminologies and classification systems to codify nursing data. So all educational programs are expected to nurses are in educational programs. Speaking of educational programs, nurses are expected to use a variety of technological tools and complex information management systems that require skills in analysis and synthesis to improve the quality and knowledge, skills, and attitudes must be integrated throughout the nursing curriculum. This is not optional, and having just a single course will not help. So this nursing informatics course that we are doing right now will not gonna help you to advance your profession. So you have to enroll in a more focused, more um, what do you call this? More focused and um, better or a master's degree soon for nursing informatics. Clearly, we are at the tipping point that nurse educators can no longer ignore the informatics agenda. Informatics are everywhere. Rather than merely knowing what buttons to push for documentation, our students must begin to understand the concept of being a meaningful user. My biggest fear is that schools of nursing will run out to buy HR simulations or contract with their clinical agencies, spending all their time teaching students how to use the software rather than how data, information, and knowledge can improve patient care and inform their practice. So sometimes I'm asked, like, Domino, did you teach the students to do computers, all the stuff and all the can you teach them how to type and how to create PowerPoints? Actually, I'm so sorry to tell you that this is not the subject to teach you how to do PowerPoints and how to do videos. This subject teaches you how to process data, information, knowledge to improve patient care and information and inform their practice. So that's what we're doing. That's why I'm always asking for your reflection. I'm always asking for your critical thinking. And I'm always asking, what do you want to suggest? Because this is nursing informatics. This is not a computer class, okay? So making videos, making those dramatic, artistic posters is not part of this. So we are into the business of um, processing data, okay? To redesign computer engagement, consumer engagement, and healthcare delivery, nurses must understand innovative technology tools and experiment with them. If we are truly at the crossroads of transforming healthcare, nurses must have the knowledge and skills to use disruptive innovations to facilitate and encourage new methods to deliver healthcare. When you say disruptive innovations, these are innovations that will bring change. So we must think outside the box from new partnerships and ask our students for their ideas about how to transform nursing practice. So in this course, I have asked you several times, and in this unit alone, I'm asking you to participate in the virtual gaming simulation and then ask you how to transform your nursing practice. So that's how we critically think about nursing information. So if you don't, you have to participate in the design in participate in nursing informatics, because what suffers, your patient safety will suffer if you don't participate. So we have come to the end of this unit. Congratulations on completing your module, The Future of Nursing Informatics. By now, you should be able to examine the future of nursing informatics, explore current issues in nursing informatics, discuss nursing informatics yesterday, today, and tomorrow, identify challenges in informatics, examine future trends in informatics, and describe informatic tools on the web. Use this checklist to be sure that you have completed all the tasks related to this week's lesson. Have you completed the following? Completed watching and required video discussion, this one. Completed the required reading, all that attached under this video, and completed the activities to reinforce reading. Complete the knowledge checks and participated in the virtual gaming simulations. According to Mark Surge in 2011, that we are living. These are the historic times for the healthcare industry and the profession of nursing. Informatics provides us an opportunity to help transform not only the care delivery system, but the very professions it relies on to deliver safe, effective, and evidence-based care. Therefore, in order for nurses to be prepared for the rapidly changing healthcare environment and the explosion of computerization and technology, there will need to be strong leadership, effective communication, organized training sessions, established timeframes, plan change, and customized softwares. Transforming nursing profession will require leadership, practice, and education. Will you be ready? And I hope so. The following are the references that I use for this lecture, and majority of these references are included. The PDF is included in this lecture, and I think that's the end of our lecture for Unit 7, The Future of Nursing Informatics. Thank you so much for listening, and have a great day. Bye bye.